Hi, my name is Minh-Chau, and I will be discussing the healthcare system in the United Kingdom as it relates to the United States. So the type of healthcare system in the United Kingdom, it's government funded, it's paid through taxation of citizens, and it provides universal coverage to all. And the main body is called the National Health Service, which ensures treatment and services to everyone in the United Kingdom. It was recently devolved a few years ago, so each of the four nations of the United Kingdom have basically a subsection of the NHS, and they basically now address their own individualized needs for their respective nation, rather than having the National Health Service address needs for the entire United Kingdom. And the NHS also monitors and publishes findings on health disparities in the UK, and they strategize and ensure that communities receive resources that are needed to address those disparities. And the UK compares to the US in the healthcare system in that the US is more of a mix of private and public, whereas the UK is more public. So the US, there are a few public insurance entities like Medicare and Medicaid, but it's also mainly private, and the healthcare providers are also private. And then life expectancy from birth to death. So in the United Kingdom, the life expectancy is at least a few years higher than the life expectancy among all people in the United States. There's at least a 2 years gap for life expectancy for men and women in their separate categories in the UK. And this past year was actually the first year where life expectancy stopped improving in the UK, and researchers are trying to figure out whether it was like an increase in deaths due to a flu season in the winter months or something else. So they're researching that right now. And it's interesting that life expectancy in the UK is higher when they spend less than half of what the United States spends per person. So the UK spends a little over $4,000 per person per year for healthcare, whereas the US spends over $10,000 per person per year. And there's a graph here, and this red bar is the United States in spending per person per year. It's one of the highest in the world. The second to highest are Norway and Switzerland, but they're still significantly lower. And the UK is over here. It's one of the lowest in the world in terms of spending per people. So emergency department visits. For the UK, there's about 27,000 people, and for the and that's in England, and then there's a little bit over 34,000 people for Northern Ireland, and there's been about a 25% increase in emergency department visits in the UK since 2004, but both numbers are still significantly less than the United States department visits, which is a little bit over 43,000. And I'm thinking that the fewer visits is due to the free general practice care, which allows people to not have to visit emergency departments and use their resources as often, though it does still happen. And then tobacco control efforts in the United Kingdom. There's more regulation than the United States. So for advertisement, there's bans on television and radio, like in the United States, but there's also bans in billboard advertisements, what else? Magazines, newspapers, and then for packaging, the warning needs to cover at least 65% compared to the US's 50%. And smoke-free places, the US it's just government facilities, whereas in the UK it's government facilities, workplace facilities, educational institutions like universities and schools, and public transportation vehicles like buses. So safe drinking water, the UK follows standards set by the European and European organization and World Health Organization, and about 96,000 per 100,000 people use services that provide free drinking or safely managed drinking water, and all 4 nations in the UK follow 99.8% compliance rate with the standards set by the World Health Organization. And then this compares to the United States. 99,000 per 100,000 people in the United States follow or receive water from safely managed drinking sources. But oddly enough, about 6,000 per 100,000 people might have been exposed to unsafe drinking water in the past 3 years. In 2015, they studied water contamination and found that the water levels may not have been up to regulation. So, rate of uninsured adults in the United Kingdom, virtually everyone is covered by insurance. So access is good, but the drawback is that the quality of care may be not as good, and then there are longer waiting times and the drugs are rationed more. But this compares to the United States, where 10.7% of people are uninsured, so they're not receiving the adequate care, although services might be higher in quality. And then for the insured, 65% is private and 25% is public insurance. So unemployment rates, the UK has a 4.1% unemployment rate, and the US has a 3.7% unemployment rate. So UK unemployment rate, it's been decreasing, but it is sort of increasing for the younger people below 24. They make up a large percentage of unemployed people. And the US has an all-time low percentage right now of 3.7% unemployment rate. Conclusion, the UK spends less in healthcare than the United States, yet life expectancy is higher and everyone receives coverage, whereas in the United States, if you don't have the money, you can't receive healthcare. And then some drawbacks to the UK's universal coverage is that the quality might be lacking, and you might have to wait longer to receive care, and some of the resources may need to be rationed more. But I feel that that is better to the alternative where you can only get care if you can afford it. And then here are my references. There's a long list. Thank you. Okay.